Welcome to RX Report, where you get your health, your news delivered. I'm your host, Mason Manuel, coming to you with a very special episode here from the home of pharmacy at the American Pharmacists Association in Washington, D.C. We're here on the terrace for the APHA kickoff event for American Pharmacists Month, where we will be hearing from leading speakers in the pharmacist profession. We're joined today by pharmacists from all walks of life. We've got student pharmacists, technicians, federal chiefs, and more. They're going to be talking about a lot today, so be sure to click that like and subscribe button, and let's dive in.
We thought that today, rather than having the typical keynote speaker to come from outside of pharmacy, we thought that we would bring all of the national pharmacy associations here and give them an opportunity to say a few words to all of you to talk about this collaboration that we're experiencing in the profession. So let's start with Lee Vermeulen, the Executive Vice President and CEO of the American Association of Colleges of Pharmacy. Lee?
Thank you, Michael, and good morning. The American Association of Colleges of Pharmacy represents all 141 accredited colleges and schools of pharmacy in the United States, and we are the cradle of our profession. We represent over 50,000 student pharmacists, doctor of pharmacy candidates, over 5,000 graduate students, and nearly 15,000 faculty and professional staff in our member institutions. We're really pleased with our student pharmacists that are here today to start and celebrate American Pharmacists Month on a positive note. We want to call out the incredible things that our colleagues in our schools of pharmacy and colleges of pharmacy, what our faculty and our amazing student pharmacists are doing to care for our patients. So thank you very much.
And next is John McGlew, the Director of Government Affairs for the American College of Clinical Pharmacy.
Well, good morning, and thank you very much, Michael. Thank you very much, everyone, for this wonderful event. I'm here to represent the American College of Clinical Pharmacy. We represent around 15,000 pharmacists across the country, practicing across all practice settings, but with the common goal of helping, working as part of teams to help optimize medications on behalf of patients. And that's the message in my government affairs capacity that I bring to Capitol Hill and other policymakers. Now, I'm quite self-conscious up here, acknowledging that I'm probably the least qualified person to talk about clinical pharmacy, to talk about pharmacy in this room. I'm not a pharmacist. I'm a government affairs person. So my job is to tell the stories about pharmacists and help policymakers and people in positions of authority, decision makers who have control over our healthcare system, the regulatory systems, the legislative systems, help them better understand the value that pharmacists bring to care teams and why pharmacists are essential members of the care team if we're going to improve medication use for patients in this country. Now, a lot of the work I do is advocacy. I'm an advocate on behalf of pharmacists and behalf of the patients that you take care of. And something that I've learned from working with pharmacists is that all pharmacists are advocates. That's inherent in the practice of pharmacy, I've observed. You advocate on behalf of patients, helping patients navigate complex situations, helping them navigate coverage situations, helping patients understand their medication use through different prescribers, and helping patients and caregivers and families navigate a very, very complex healthcare system. You see how much pharmacists are committed to helping patients helping improve patient lives. So I'm really excited to be here on American Pharmacists Month. I thank you for inviting a non-pharmacist up here to give some comments. You're not an insular group. You're a collaborative group. You work with other stakeholders, and that's evident by the fact that you welcome me up on stage. So thank you very much, and congratulations on this American Pharmacists Month.
Next is Chief Susan Cantrell, the Chief Executive Officer from the Academy of Managed Care Pharmacy.
Thank you, Michael, and thank you to the Board of Directors, staff, and Michael for bringing us all together today. I'm with the Academy of Managed Care Pharmacy, and for the student pharmacists in the audience, our members work in non-traditional settings for health plans and pharmacy benefit managers in the pharmaceutical industry and other settings, but they're united by the common thread of ensuring patients have access to the medicines they need at a cost they can afford. And I know we all know that proverb, if you want to go fast, go alone. If you want to go far, go together. And it's that spirit that unites us in pharmacy today, because we want to go far and we must go far. Unity is one of our greatest assets, I think, in this profession, and it's a delight to be with all of you today. We're facing some challenges in our environment right now, and despite our different roles and practice settings, we're united by a common goal: improving patient health by optimizing medication use and access. So in short, our profession exists to help the patients that we serve. And I want to highlight some of the strengths that we possess as a profession and some areas where we've stood together to be stronger. Certainly the COVID pandemic is a great example of where pharmacy worked together, pulled together to step up and help the patients that we serve. And most recently, you've seen our collective work on vaccine access and the impact that that's having. Really important work. We also see it in the steadfast support that all of us have for the Ensuring Community Access to Pharmacist Services, or the ECAPS Act. So these are challenging times for all of us. Just in the last week, we've seen threats to vaccine access. We've seen threats and questions around science and evidence. A major announcement yesterday from the administration about a new direct-to-consumer distribution channel for patients for prescription medications. Changes to HB1 visas that further challenge our workforce, and also a major tariff announcement affecting prescription drugs and threatening to make them even less affordable than they are today. And that was all just in the last week. So we deal with this. How do we deal with this in pharmacy? We deal with it by collaborating with one another, playing to our strengths, leaning on our colleagues, and also leaning into what we believe and what we know. So to the student pharmacists that are here, I would say we look to you to carry on this collaboration in the future and to advance our profession. I couldn't be more honored to stand here with our colleagues today, with my friends and partners, as we celebrate National Pharmacy Month and also work to improve the lives of Americans one patient at a time. Thank you very much.
Well, this next guy I thought had retired, but I learned this morning that he apparently hasn't. Pleased to introduce Arnold Clayman, Vice President of Professional Affairs for the American Society of Consultant Pharmacists.
I recently did retire as Vice President of Professional Affairs from the American Society of Consultant Pharmacists. Our organization is composed of probably about 5,000 pharmacists across the country, and what they do is manage the medication use of older adults, especially in facilities, but also in community, and in a variety of facilities. And I got to see firsthand, behind the scenes, how the pharmacy staffs of the organizations work together. And we really do work together. The association staffs work on the issue of pharmacy practice. So things like the pharmacist patient care process, which was published in 2014, and the newest version is just coming out now. The Health Information Technology Collaborative, which is really important to the future of how we practice pharmacy, and very important to me is government affairs, things like legislative and regulatory affairs. So kind of echoing what Susan said, this became crystal clear when we went through the pandemic, because pharmacy went through the pandemic together. And originally we met at least twice a week, sometimes more, every week, so that we could talk about what did we need to do, exchange information, and advocate for pharmacy in the whole pandemic scenario. Those weekly calls continue to this day, sometimes every other week. And we're dealing with other issues that affect our profession, like ECAPS and vaccines and other pressing issues. As we've just heard, every week there's something else that hits us. So it's been a privilege to work at ASCP on some of these issues. Some of the things we really concentrated on are like the measurement of the appropriate use of antipsychotic medications in long-term care facilities, which has actually started to bleed out in the community, and we knew this would happen through congressional hearings. We're starting to hear about monitoring its use in the community. The work of the consultant pharmacist has always been about medication management. First it was focused on residents of facilities, skilled facilities and assisted living, and then into the community. But I really see medication management, this work, as the future opportunity for pharmacists. So I see the future for pharmacy as being bright, as long as we can continue to work together and push for these issues. So thank you very much.
Thank you. And next is Melanie Dodd, President of the American Society of Health Systems Pharmacists.
Good morning, and thank you for having me this morning. The American Society of Health System Pharmacists represents pharmacists as well as the entire pharmacy workforce that practice in hospitals and health systems. And this morning, it is fantastic to be here with all of you to kick off American Pharmacists Month, one of my favorite months of the year. Working together on professional issues and advocacy priorities strengthens our collective voice and helps us make a bigger impact on the melody of healthcare. I am optimistic about the future of the pharmacy profession, not only because of the important work pharmacists are doing today, but also because of the opportunities ahead. We're seeing new roles take shape, expanded authorities granted, and a future that holds true promise. As the profession continues to evolve, pharmacists have an opportunity to embrace technology like artificial intelligence that will expand our roles and enhance patient care. In addition, the growing number of older Americans will increase the demand for pharmacist expertise, making our contributions more essential than ever. So with that, I wish you best wishes for a great American Pharmacy Month and for an amazing year ahead. And may we all keep moving in harmony toward a healthier future. Thank you again.
Brooklyn Morgan is the Director of State Policy for the National Alliance of State Pharmacy Associations, or NASPA.
Hi everyone, thank you for having us here. My name is Brooklyn. I'm Director of State Policy at the National Alliance of State Pharmacy Associations. You may not have heard of us. NASPA often works in the background, and that's okay, as long as you are involved in your state pharmacy association. So your state association is working on your behalf, doing all similar efforts as what we've heard from the other nationals just at the state level, and they are representing you and your voice for pharmacy in your state. So really glad to be here, and thank you so much.
Next is Doug Hoey, the Chief Executive Officer of the National Community Pharmacists Association.
NCPA represents the nearly 19,000 independent community pharmacies throughout the United States. We're the laboratories of innovation for the profession, and in my very biased view, we are the heart and soul of our great profession. Every day should be a good day to celebrate American pharmacists. But lately there's some programs that have been announced that bypass local pharmacists, and some of those have gotten to be in vogue, these direct-to-consumer programs that Susan mentioned. And direct-to-consumer could be okay, but the way they've been defined bypass local pharmacies. And nothing could be more contrary to lowering prescription drug costs, lowering healthcare costs, and most importantly, doing the best thing for patients than bypassing the local pharmacist. Patients shouldn't have to chase a discount and go through a mail order pharmacy just to get the lower price that they deserve. Prescription medications are vital, essential tools. The medications are commodity, they're the tools, they're very vital. But without the pharmacist, they're the hammer and nails without the carpenter. NCPA joins its colleagues in celebrating American Pharmacists Month for all it means to our great profession and the patients that we serve. Thank you.
Next is Tamara McCants, the President of the National Pharmaceutical Association.
Hello and good morning. I am Tamara McCants, the current President of the National Pharmaceutical Association. And we represent the views of Black and other minority pharmacists on key healthcare issues promoting racial and health equity. and advancing pharmaceutical care standards, all while serving the underserved community. With over 3,000 members, including our students, we have persevered and stayed true to ensuring that the most vulnerable receive the best health care from the most accessible healthcare professional, the pharmacist. American Pharmacists Month is literally the official start of the holiday season. It is an exciting time for us to celebrate who we are and what we provide every single day. We are very grateful for a continued collaboration amongst the profession leadership, open communication, and true commitment. We all know that when diversity is in the room, that everything gets better. And we are very grateful to the American Pharmacists Association and all of our other colleagues for continuing to allow that we have a safe space to express our views and that we have real, true relationship and conversation, tough conversations. So especially thank you, Michael, specifically for answering all of my calls. So we enthusiastically work to enhance our infrastructure and our members in our quest to strengthening pharmacy for all. Thank you.
I think I'm feeling the holiday spirit. Should we just say Merry Pharmacist from now on? Is that it? Next is Magaly Rodriguez de Bittner, the President-elect of the American Pharmacists Association.
Well, good morning. Buenos dias. How are we feeling? Good? All right. So it's a privilege for me to be here in the home of pharmacy, but more than anything, your home. This is your home. With bright student pharmacists from Virginia Commonwealth, University of Maryland, Baltimore, Howard University, Notre Dame of Maryland, and University of Maryland, Eastern Shore. Please give an applause for these students that are here with us today. I know we keep telling you over and over again that you truly represent the heart and the future of our profession, but you are. Today, we launched the 21st anniversary of American Pharmacists Month under a theme that captures the best essence of what we're calling caring for our communities. These 4 words tell our story with elegant simplicity. They speak to our why we chose this path, why we persevere through challenges, and why pharmacy remains one of healthcare's most trusted professions. Students, you stand at a pivotal moment in healthcare history. The profession you're entering is not just evolving, it's really transforming. Healthcare needs your innovation, and as we call it at the University of Maryland School of Pharmacy, pharmapreneurship. And it also needs your compassion. Patients need you to be a medication expert when confusion reigns, when there's so much misinformation, when we need to remind them to trust science. But your communities would also look to you not just for medications, but really guidance to make decisions in their complex healthcare journey. They will seek your counsel during the most vulnerable moments. So your reassurance during these times, your leadership in public health crises is needed now more than ever. This is a magnificent opportunity before you to redefine what pharmacy means to healthcare, what it means to society, but more than anything, what does it mean to you? The strength of pharmacy has always resided in a unity across diverse practice settings. We're stronger when we recognize our common purpose, share challenges, and solve them together. To the distinguished pharmacy leaders with us today, your unified presence sends a powerful message to these student pharmacists and to our profession. Your collaborative leadership amplifies our collective voice in advocating for our patients, our communities, and our profession. To every student pharmacist here today, I challenge you to embrace the theme, caring for our communities. Not as a month-long theme, but as your professional North Star, as your purpose. When you counsel patients with empathy, when you collaborate with other healthcare providers to optimize outcomes, when you advocate for health equity and access, you embody this theme in the fullest expression. You are fulfilling your purpose and your why. These are the small moments that you should embrace because they bring you joy as a pharmacist. So embrace them, not the big achievement, but those small times when you're making a difference in patients' lives. So thank you, gracias, happy American Pharmacists Month, but also I'm gonna take a privilege to say happy Hispanic Heritage Month. Thank you.
I'm going to ask the Executive Director of Pharmacy Services and Pharmacy Benefit Management Office for the Department of Veterans Affairs, Tom Emmendorfer.
Good morning, everyone. It's really a privilege to be here at the start of Pharmacy Month. This month, we celebrate pharmacists everywhere. We celebrate the quiet dedication, the long hours, and the steady commitment to safety and care. But more than that, we celebrate the fact that pharmacists are integral to the health of this nation. We had over 6 million direct care encounters between veterans and clinical pharmacist practitioners with a scope of practice. Tens of thousands of educational visits aimed at making care safer and more effective. But behind those numbers are people. Veterans who rely on us not for just medications, but for peace of mind. We had over 6 million direct care encounters between veterans and clinical pharmacist practitioners with a scope of practice. Tens of thousands of educational visits aimed at making care safer and more effective. But behind those numbers are people. Veterans who rely on us not for just medications, but for peace of mind. What makes VA pharmacy special is not just our size, but it's our spirit of innovation. Our consolidated mail outpatient pharmacy systems, which are 7 of them across the country, fill more than 130 million prescriptions each year with precision and speed, allowing our pharmacists to practice at the top of their license. Our mobile pharmacy units are there in times of the nation's needs to bring care to the front lines of disasters and emergency, make sure veterans are never cut off from the medicines they need. And our clinical pharmacist practitioners are reshaping what it means to be a pharmacist. Operating as advanced practice providers, prescribing medications, managing treatments, and working shoulder to shoulder with physicians and nurses. They are proof that pharmacy is not on the sidelines. It is central to the team. We're also looking ahead. Pharmacogenomics. It's helping us tailor therapies to the genetic profiles of veterans, making medicine more personal than ever before. Our Close to Me program is ensuring cancer therapies are available closer to home to our nation's veterans. Our academic detailing program is helping prescribers across the system adopt safer, smarter practices. Here's the larger point. In every corner of VA, pharmacists are leading. They are advancing science, strengthening safety, and ensuring quality. They are showing what is possible when pharmacy is given the tools, the trust, and the responsibility to lead. And that brings me to the pharmacy students in the crowd. Thank you for coming to this event today. At one time I was a pharmacy student, and all of us here can remember what it was like, so thank you for what you're doing, and thank you for your service. This is the profession you are stepping into, a profession where you'll be asked to use not only your knowledge, but your judgment. Not only your skills, but your compassion. You will be asked to innovate, to adapt, and above all, to serve. You are the future of pharmacy. You are stepping into a profession that will challenge you, inspire you, and most importantly, give you countless opportunities to improve lives. We're counting on you. And judging by the energy and commitment that I've seen in this next generation of pharmacy students, I know the profession is in good hands. So as we begin Pharmacy Month, let me say thank you. Thank you to APHA for bringing us together. Thank you to pharmacists everywhere for your service and dedication. And thank you to the students for being brave enough to choose this path. The future of pharmacy depends on you, and from where I stand, the future looks really bright. And happy Pharmacy Month, everyone.
And last but not least is Captain Tami Rodriguez, Director of Pharmacy Programs for the Federal Bureau of Prisons, United States Public Health Service.
For those of you that don't know who we are or what we do, we are a uniformed service under the Department of Health and Human Services, stationed in over 48 different agencies throughout the United States and the world. Many of us are called here to serve the underserved. That's where my heart is, and I'm so grateful to have found the opportunity as a student in pharmacy school and then later in my career to be able to do that. To the students in the room, you have chosen an extraordinary profession. Pharmacy offers an immense range of opportunities, from clinical care to research, public health, policy, and beyond. If you had told me when I was in pharmacy school that most of my career would be spent in corrections and in prison, I would have never believed you. But it has been the most rewarding thing I could have ever done. I have loved going to work every day. But more than the variety, it's the impact that matters. Every day, you're on the front lines of health, education, prevention, and healing. You will be the person to help a mother understand their child's medication. You'll be that first person who catches a dangerous interaction before it happens. You'll guide communities through public health crisis. I hope we never encounter something like COVID again, but if we do, I am confident that pharmacists will be there to answer the call and to serve our communities. It's not just a job, it's a calling. What makes pharmacy so powerful is that we blend science with service. We are trained to think critically and to always stay curious. We adapt, innovate constantly. As the science evolves, so do we. And I think that that is very particular to our profession. I get a lot of groans when I bring up the most recent evidence or the recent research or this is what they say to do now for hypertension. But that's what we do. That's what our responsibility is. Finally, always remember, at the end of every prescription, every consultation, every clinical or administrative decision you make, there's a human being. That human being has the same fears, hopes, and challenges that you do. Be kind, be present. See the humanity in everyone you serve. Thank you so much for the opportunity to be here. I hope you have a great Pharmacist Month. Thank you for the honor to speak, and have a great day. Thank you.
We've offered the opportunity for our gold sponsors to share a few insights. McKesson and Walmart. McKesson was unable to join us this morning, but we're delighted to have with us Lisa Smith, the Vice President for Clinical and Specialty Services with Walmart. Lisa?
Good morning and thank you. Just wanted to share a few words on behalf of the 15,000 pharmacists at Walmart serving communities across the nation. Michael mentioned my title. I'm the Vice President of Clinical and Pharmacy Services, so our specialty pharmacy as well as all of our non-dispensing services. But if you ask my kids what I do, they're going to tell you that mom's a pharmacist. And I hope no matter what my title is, that that's the thing that they'll always say, because second to mom, pharmacist will always be my favorite title. I think we have an amazing opportunity in community pharmacy. Our pharmacists are serving in different ways than ever before. At Walmart in 21 states, we're offering testing and treatment for flu, strep, and COVID-19. In 32 states, we're prescribing hormonal contraceptives. And just last month, we launched our first pharmacies now testing and prescribing PrEP and PEP for people living with HIV and prevention of HIV. So we think our pharmacists are serving in ways that they haven't before, and they're going to continue to serve in new ways. I think there's never been a more exciting time to be in pharmacy, but in community pharmacy in particular. I thought maybe I would end with a story that maybe resonates with the student pharmacist and hopefully gets you excited about the profession that you're joining. My husband and I recently took our kids to a Jonas Brothers concert in Northwest Arkansas. And when the Jonas Brothers came out, they were definitely clapping, they were excited, they were singing along. But as sometimes happens at a concert, they panned the crowd. And at the same time, my kids jumped up and down, pointed, were screaming, and they said, "Mom, Mom, it's Mr. Michael." And they were pointing. Well, Mr. Michael is the pharmacy manager at our local Walmart pharmacy. And my husband, who doesn't often engage as much in their healthcare as I do, turned to them and said, "Who's Mr. Michael?" Because they were so excited, and they looked at him with an eye roll that only a 10 and a 13-year-old can do, and they said, "Dad, that's our pharmacist." And it struck me that they could have said a lot of things. They could have said, "Mr. Michael works with Mom." They could have said, "He's the pharmacist at Walmart." But they said, "Dad, he's our pharmacist." And so as I left that concert last night, it was a reminder that every day at Walmart, I get to serve 15,000 community celebrities. But if you're a student pharmacist, you have the opportunity to be a celebrity in your community as you graduate. So it really struck me that this caring for communities, that's what our pharmacists are out there doing every day. So happy American Pharmacists Month. We're glad you're here and appreciate the time.
In addition to this Kick Butt Kick Off event, we also went to New York City, where we had student pharmacists represent the profession on various programs being filmed out there in the Big Apple. Now, they had a lot of fun, but I'm completely offended that nobody brought me back a slice.
Wise man say, forgiveness is divine, but never pay full price for late pizza.
Anyway, pharmacists were all over the city making their voices heard, and you can't help but love it. We've got even more coming this American Pharmacists Month, so be sure to stick right here on our X Report as we publish special episodes every week showcasing more of the profession. Special thanks to our special kickoff event sponsors, including McKesson, Walmart, Amazon Pharmacy, CVS Health, and Bovinger Ingelheim. Till next time, our executive producer is Rob Hodges, our creative producer is Kate Erdman, and until next time, I've been your host, Mason Manuel. Be sure to tune in this coming Friday for more RX Report and check out this incredible launch video we made to kick off this very special month. But till Friday, bye y'all.
The days are long. The demands are great. But with each new day, our doors open and our communities walk in. We are the most accessible healthcare providers in nearly every community. We devote ourselves to a lifetime of service to others. For safer communities, better outcomes, and healthier patients. But right now, pharmacy and healthcare is in transition. And in this time of change, our profession has never been more vital. So we'll keep showing up for our patients, for pharmacy, for you. We are pharmacy. Happy American Pharmacists Month.